Men, how far would you go to help your partner? Dax Shepard's story will shock you. Imagine having to suck out a clogged milk duct to relieve your wife's pain. Let's dive into this as we uncover the truth on mastitis. Before we even get into the story, what is mastitis anyway? So mastitis is a fancy word that means inflammation of the breast tissue. So this is how our breast works. Milk is produced by the body and stored into little containers known as ducts. So when the milk is in the ducts, it's supposed to be let out through the nipple. And what happens here is the milk is not let out, so we are having a clogged duct inside. So every time we are having something clogged, we are going to get an inflammation, which is known as mastitis. We have two types of mastitis. We have the infectious mastitis and the non-infectious mastitis. With the infectious mastitis, our inflammation is having bacteria around. So every time we get a clogged duct, milk does not stop being produced. Our body is still going to produce milk, and every time it is not being let out, we are going to have bacteria come around, and you're going to have an infectious mastitis. So if you ever find out that you have an infectious mastitis, please do not breastfeed your child on this milk. The non-infectious mastitis. The non-infectious is just an inflammation. Really, there is nothing much and you should not worry about this because you are safe. It is just a clogged duct, and the moment the milk is let out, you are going to be okay. How do we even get mastitis anyway? So, as I've just explained, it is a clogged duct. So how we get it is how it gets to the clogging. Every time as mothers, every single time we don't breastfeed our children, the milk is going to stay in the breast and milk is going to keep clogging and piling all the time. Putting on tight bras as well. So what tight bras do, they do not let our breasts bring the milk out. So it's going to be a clog that is tied inside because the bra is too tight on yourself, and really the breast also can't do much about it apart from putting the milk in one place. How do you know that you have mastitis? There's going to be redness around your breast. It will be extremely painful. Mastitis is a very, very painful and terrible condition because you can barely sleep. Your hand can't even move because you're having this batch of milk into your breast. So it's very painful. It's going to be red and you're going to have a tight chest. You can barely lean behind or even in front because you're having milk. So basically it is like carrying a stone onto your chest. That is how mastitis feels like. So every time you feel like your chest is clogged and you're having tightness, it is not a heart disease, mother. It is mastitis. How can we treat mastitis? Starting with the mastitis that is non-infectious, I'll give you a simple trick. So you just have to get a warm cloth and put it on your breast. Let the milk flow, let the milk out, and the clogged duct will clear. 2, let's breastfeed our babies. Breastfeeding is the most preventative measure of mastitis. Every time your child breastfeeds and this milk is being let out, you can never suffer mastitis. If you can't breastfeed and you are a working mom, please pump this milk for your child and leave it at home for them to take. So after understanding mastitis, let's go back to our story. So Kristen had this severe pain that we've been talking about. She could barely move. Her chest was too tight. And what Dax did was sucking out all this milk from the clogged duct. Men, would you do this for your wife? I doubt you. Dax removing all this milk with his mouth into the cup was a very wonderful act to help Kristen overcome mastitis. I believe some of us have experienced this pain that Kristen had. What did you do for your mastitis? Let's help a mother out there by you sharing your experience in the comment section. And if you found this content helpful, please consider subscribing and following our socials.